Hi, my name is Christy Farrell, and I am a graduate assistant athletic trainer here at Campus Rec. Today, I will be taking you through the club sports COVID-19 training. So, welcome, and let's go ahead and get started. In this training, you will learn how COVID-19 is defined, understand the common symptoms of COVID-19, learn how to protect yourself and others, and learn how COVID-19 specifically impacts athletes like you. So first, let's talk about COVID. We know that it's impacted our world, but what actually is COVID-19? COVID-19 is a disease caused by a new strain of coronavirus. CO stands for corona, VI for virus, and D for disease. This virus is a new virus that's linked to a family of viruses that's known as severe acute respiratory syndrome, or SARS, and some types of the common cold. COVID-19 is spread through person-to-person contact by breathing in droplets that are infected with the virus. So if somebody is infected with the virus and they cough or sneeze around you and you breathe it in, that's one way that it can be spread. Another way COVID-19 can be spread is by touching an infected surface and then touching your nose, your mouth, or your eyes. And remember that COVID-19 can survive on surfaces for hours, but it can be killed with disinfectants. So now let's talk about what the symptoms of COVID-19 are. Remember that these symptoms can present as mild or severe, and there's a wide range of symptoms. An infected person may demonstrate some symptoms, but not all, and people can have COVID-19 and show no symptoms. Also remember that symptoms generally appear 2 to 4 days after exposure, but you are contagious 2 days after contracting the virus. Now that we've talked about the symptoms of COVID-19, let's talk about what the specific symptoms are so that we can identify them. This is a list of signs and symptoms that has been provided by the CDC. So COVID-19 signs and symptoms include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Please keep in mind that this is not an exhaustive list of symptoms, as we are still learning about COVID-19. As we learn more about it, and if more signs and symptoms do develop, the CDC may add to this list. Okay, so let's talk about emergencies in terms of COVID-19. The emergency warning signs include trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face, and those are the emergency warning signs. Now, if these signs and symptoms are present, call 911. Call ahead to your local emergency facility. Let the operator know that this person is a suspected COVID-19 case or they have been diagnosed with it. So again, if these signs and symptoms occur, call 911. Okay, now we're going to talk about COVID-19 risk factors. Some people are at a higher risk of contracting COVID-19 or of suffering more severe symptoms. So individuals with the following conditions are at a higher risk: older adults, people with chronic kidney disease, people with COPD, individuals with compromised immune systems, those with obesity, serious heart conditions such as heart failure, individuals with sickle cell disease, and individuals with type 2 diabetes. Remember that these individuals are at higher risk, but people of all ages and health levels are able to contract COVID-19 and suffer from symptoms or pass the virus on to others. Okay, so now we know what COVID-19 looks like and how it's defined. But what do you do if you think you have it? If you have a fever, cough, or other symptoms, you might have COVID-19. So, if you suspect that you do, stay home. When you stay home, try to quarantine to one room if you can, especially if you live with others. This protects your roommates to help stop the spread. Only leave your home to get medical assistance and avoid public transportation such as taxis, Ubers, or buses. Next, monitor your symptoms. Keep track of what symptoms you're experiencing, take your temperature to see if you have a fever, and write down your symptoms if you're worried that you will forget them. Then, watch for emergency signs and symptoms. Remember, we just discussed these in slide 7, and you can refer to them in the PowerPoint as well. So if you see any of these signs or symptoms in yourself or in a friend, call 911. And lastly, call ahead to the doctor. You want to call ahead because some of their policies and procedures might have changed due to COVID-19. Okay, so ECU has some new policies in place. One of them is that if you do suspect that you have COVID-19, go ahead and fill out the ECU symptom screening. It is provided in this link right here. This will take you to a website with more information about it and a link to the screening. Fill out the ECU symptom screening, and after submitting the screening, you will be given instructions on how to proceed. So this is through ECU Student Health, and they can instruct you on what to do next. Also, the CRW athletic trainers will be conducting COVID-19 screenings. If CRW athletic trainers do not flag your symptoms during the screening and contact you first, you need to tell the CRW athletic trainers that you are experiencing COVID-19 symptoms. We ask you to do this because we are medical healthcare providers and we do work with doctors, so we can refer you to the appropriate resources. And this helps protect yourself and others around you that you may have come in contact with. So make sure that you are communicating with the Campus Rec athletic trainers. Okay, so now we've talked a little bit about symptom screening. We'll talk a little bit more about it so that we can let you guys know how we will be doing symptom screenings. CRW athletic training will be conducting COVID-19 symptom screenings before each practice. You guys need to download the Sway Medical mobile app. This is the same app that we use for concussion baseline testing. So if you were a club sport athlete last year, you might remember this. This is how we did your baseline testing. The app looks like this. It has 4 bars and it's blue. And the app can be found by searching Sway Medical in the App Store or Google Play. We will provide you with more information on how this will work at a later date. Okay, self-reporting. Fill out ECU's COVID-19 self-reporting form only if you have experienced the following in the last 14 days. So if you've been diagnosed by a medical provider with COVID, if you've been instructed to self-isolate, or if you've been advised to self-quarantine due to exposure to COVID, please fill out the COVID-19 self-reporting form. This link will also be provided in the additional resources handout. The self-reporting form is also found on Pirate Port, and filling this form out allows for ECU Student Health Services to follow up with you and make sure that everything is okay. Okay. So, where can you get tested for COVID-19 here in North Carolina? You have a few different options. First, ECU Student Health Services will be conducting COVID-19 screenings. If you'd like more information on this, we can definitely provide you with that. Please send us an email to crwathletictraining@ecu.edu. CVS and Walgreens are also conducting COVID-19 training or COVID-19 testings. As well as the state of North Carolina is offering drive-up locations through this link. These are free and self-monitored tests. You can use this link. It will also be provided in the resources handout that we provide you with during this Canvas training. Okay. So we understand that COVID-19 is a serious health concern. So let's talk more about protecting yourself and others. There are a few quick things that we can do in order to protect yourself and others. Wash your hands frequently, socially distance, wear a mask, clean and disinfect, and monitor your daily health. This is what you can do to protect yourself and others, and now let's talk about these more in depth. First, wash your hands frequently. So make sure that you use soap and water for at least 20 seconds. If you don't have soap and water available, use hand sanitizer that has at least 60% alcohol. And avoid touching your eyes, nose, and mouth with unwashed hands. It is especially important to wash your hands before eating or preparing food, before touching your face, after using the bathroom, after leaving a public place, after blowing your nose, coughing, or sneezing, after you've handled a cloth face covering, like your mask, after changing a diaper, after caring for somebody who is sick, and after touching animals or pets. So, in short, make sure you wash your hands. Okay, now let's talk about social distancing. The biggest thing to remember is when you're outside of your home, keep 6 feet distance from yourself and others. Remember that some people can spread the virus even if they're not showing symptoms, so make sure you're social distancing. And it's especially important to do this to protect those who are at a higher risk of getting sick. Okay, so now let's talk a little bit about wearing a mask. Cover your mouth and nose with a cloth face cover when you're around others. Make sure that when you wear a mask, it covers your nose and your mouth. Do not pull it down to talk to people. Make sure you're keeping it on so that you can protect yourself and other people. So masks protect other people if you are infected, and wear a mask in public settings and when you're around people that you don't live with. Avoid using masks that are made for healthcare workers. These include surgical masks and N95 respirators, but please do wear masks that have 2 layers, and you can have a filter in them that is optional. Please remember, this is a super big point in terms of masks. Maintain social distance. Masks are not a substitute for social distancing. So make sure that if you're around people in a public place, that you are wearing masks and you're social distancing. Okay, so now we're going to learn a little bit from Bill Nye about masks and why they're so important.
Greetings, everyone. Bill Nye here. Why do people in the scientific community want you to wear a face mask when you're out in public? Well, please consider the following. Face masks, like this one, prevent particles from my respiratory system from getting into the air and then into your respiratory system. Blocking the movement of air is an old trick. Here's a scarf. It blocks the movement of air around my throat, helps keep me warm. This scarf won awards in the Washington State Fair for both design and workmanship. It can block the movement of air, but only to a certain extent. This is a homemade face mask. It has just 2 layers of cloth with a pipe cleaner sewn in to help it fit against the bridge of your nose. And it blocks the movement of air very effectively. If you're wearing one of these, you're protecting yourself and those around you.
Okay, so thanks to Bill and I for creating that informative TikTok. Okay, now we're going to talk about cleaning and disinfecting. Make sure that you clean and disinfect frequently touched surfaces every day. Examples of these surfaces would be tables, doorknobs, light switches, anything that you touch frequently throughout the day. Make sure that you clean dirty surfaces. So you're going to use detergent or soap and water to clean the surface and then use a separate thing to disinfect it. So we will provide a link to EPA registered household disinfectants in the resources handout. Please remember that you shouldn't assume that spaces that you're coming into are clean. So make sure you clean the space when you come into it. For example, think about a study room at the library. These are used all day by a whole bunch of different people. Make sure that when you come into your study room that you wipe stuff down. Wipe the table down, wipe down the doorknobs, and you can use something as simple as Clorox wipes to do this. You can keep them in your backpack, and it's pretty easy and quick to do. And we will also review how to clean equipment for practices at a later time. Okay, so we've talked a little bit about monitoring your daily health, so we'll do this pretty quickly, but we do want to go into a little bit more depth. So to protect yourself and others, monitor your daily health, monitor your symptoms. So pay attention to how you're feeling, and if you start to feel any signs or symptoms of COVID-19, start to keep track of that. And pay close attention to if you are planning on running essential errands, going into the office, or going into a public space. If you're not feeling well, it's probably not a good idea to go out in public. And then take your temperature. So take your temperature if your symptoms do develop. This way you can know if you have a fever or not, and you can have the most information to understand your condition and to report any signs or symptoms that you're experiencing to a doctor or healthcare provider. Okay, so we've talked a lot about how to protect yourself and others, but now we're going to talk about specifically how to protect yourself and others and stay socially distanced when you're in college. It's a challenge to be socially distanced when you're in college and you want to see your friends. So we're going to talk a little bit about how to do that appropriately. Okay, going out to eat. Soon everybody's going to be back on campus. People are going to want to go out to lunch and to dinner. And it's not wrong to do that. Just make sure that you're following these guidelines when you do so. So when you go out to eat, wear a mask until you are seated. Try to sit outdoors if it's possible, and be conscious of how many people you're eating with or that you will be encountering. Next, we're going to talk about going out and parties. With this, remember to be smart and be safe. Bars and clubs are not currently open, but common drinking spots and restaurants are open. So follow the same guidelines as going out to eat when you are going to bars and restaurants in terms of more going out and parties. Also, really, really important thing to remember, avoid large parties and get-togethers. Be smart, be safe, be socially responsible, and protect all the people that you come in contact with, all of your friends and family members. Okay, now we're going to talk about safely social distancing in college in terms of going to the gym. We're going to watch that TikTok in a second. But first, going to the gym on your free time. So when gyms do open, make sure that you prepare ahead of time, that you limit indoor and large group activities, that you maintain social distance, and that you wear a face mask, because face masks are required. For Campus Rec, for CRW specifically, make sure you check the website for the latest updates. And super important, download the ECU Rec app for contactless sign-in and gym reservations. So this is how you're going to sign in, and you're going to reserve a spot to come work out in the gym. Let's watch this TikTok, and it'll give us a little bit more information about the ECU Rec app. Okay, so thanks to ECU CRW for making that fun TikTok. Finally, we are going to talk about how COVID-19 impacts athletes. Okay, so sorry, give me 1 second to pull up my notes. All right, so COVID-19 has been found to have cardiac or heart complications in people that have recovered from the virus. So this can be a risk factor for athletes and for active people when they are returning to exercising after they've recovered from COVID-19. However, more research needs to be done to fully understand the cardiac complications and the associated risks. So this is something we want to keep on our radar, and we'll learn more about as more research is done. Athletes are reporting higher rates of mental health conditions and mental distress during the pandemic. So for example, the NCAA did a study that found that over 1/3 of athletes reported experiencing sleep difficulties, more than a quarter reported feeling sadness and a sense of loss, and 1 in 12 reported feeling so depressed it has been difficult for them to function constantly or most every day. So please, if you're experiencing mental health illness or distress, know that you are not alone. Please reach out to your CRW athletic trainers. so that we can refer you to the appropriate medical provider. Or if you do have your own mental health resources or providers, please reach out to them. But if this is something you're experiencing, you are not alone. Please reach out. We would love to help you. All right, guys, that's all we have. Thank you for your time and your attention. If you do have any comments, questions, or concerns, please email the CRW Athletic Trainers at crwathletictraining@ecu.edu or email Hannah Roberts at robertsh16@ecu.edu. We miss you all, and we are looking forward to having you back on campus. Please, if you have any comments, questions, or concerns, reach out to us. We are happy to help. Thank you again for your time and for your attention. We look forward to having you all back on campus. Go Pirates, and bye, guys.